Hello everyone, my name is Balázs Fürjes and I am the Director of EIT Health InnoStars. I invite you to a series of inspirational podcasts where we will speak with leaders, mentors and our partners. Their insights and experience are meant to encourage new generations of creative and innovation-driven researchers and entrepreneurs from Central, Eastern and Southern Europe to come up with new solutions dealing with 21st century health-related challenges. Today, I am joined by Cristina Bescos, Managing Director at EIT Health Spain. She holds a PhD in biomedical engineering and has a long career in research and management of large international teams in digital health and healthcare transformation, combining experience from public research institutions and the private sector. Hi, Cristina. How are you today?
Hi, good morning, Balázs. It's a pleasure to be here with you.
Thank you for your time. We would like to learn more from your recent successes. The Spain CLC is the most successful this year in the application and invitation to hearings. And we would like to see what did you differently, what are your key success factors, the secret sauce of the CLC that we can learn from you. How do you keep the healthcare provider partners involved and active? Because Spain is very strong in this area.
Yes, so as you know, we have in Spain several partners among healthcare providers. We have kind of three types of healthcare providers. One is regional healthcare systems that they cover all services of a region. We have Catalonia, Madrid, and Andalusia. We have also individual reference university hospitals like Hospital Clinic, and we have also a private network, which is Sant Joan de Déu, that cover also mental health and children hospitals. So with this, I mean that we cover the full value or types of healthcare providers. So it's very diverse also in intentions. But what we can see in Spain is, and also it came across in the think tank of last year, that the ideation is often rooted in healthcare providers in Spain. So there's a clear culture among the clinicians to have ideas, innovative ideas, and to collaborate with other stakeholders in that part. So there is a natural cooperation that was there already from the start, and they are very active in the network in this part of ideation, not just in the validation part. So what we are looking is in these terms is in always looking at what the ideas that come really from clinical needs from themselves.
It's very interesting what you say, because the general assessment of the EIT Health projects is that we have too many technology push and we need more market pull. So the ideas, the projects should come from either from the industry or from the clinics. And it seems that you are managing it well because you involve your clinics early on and they come up with the ideas. But what did you do to achieve it? Because in our region, for example, it's very hard to involve them. They are burdened with administrative tasks. They are running to save the lives of the people, especially during the COVID time. And there in Spain, they have time to participate in the ideation and they come up with really good ideas.
What is working well in Spain, I think, is in most hospitals and regional services, there is an innovation unit, and they have certain structures already for collaboration in international projects. So all the administrative work and so on is kind of taken away most of the time from the activity leaders or from the clinicians, and they get quite a good support in general. And what we've done also in EIT Health this year, looking at the engagement of clinicians, is also a collaboration with ITEMAS, which is a network of innovation inside the hospitals, and see their process of innovation, exactly that part, so that also they are engaged not only in the ideation, that I think this is the part that you're saying that we do well, but that they also follow the whole process. So what we see, as you say, in EIT Health is most of the times we have clinicians only at the validation part, and that's too late. we do better in Spain in the part of engaging them in ideation, but still I think there's a pending part that is to engage in the whole process. And that is part of the work that we are doing also in Spain in this InnoDoctor project that we are leading, in looking at methods to structure the whole innovation pathway with the healthcare providers.
What you mentioned is awesome, because we don't have it in all regions. What is the origin in Spain? What is the origin of these innovative units within the hospitals and the network of innovation managers from the clinics?
I mean, the ITEMAS network, for example, it is an initiative that has been also promoted by the Ministry of Health through the Instituto de Salud Carlos III, which is kind of the innovation research branch from the ministry in order really to foster research and innovation in public system. And they have with this also created, every hospital in Spain, for example, has a research foundation linked to the hospital in order to manage more efficiently contracts or temporary staff or any kind of special support that are normally difficult to procure in the public system. And that double organization that they always have is the hospital and the research foundation. I think it's a key to have a bit of flexibility and support in order to participate in these international projects.
This research foundation, where does it get the money from?
Partly is public funded. Public is from this kind of projects. So they can have, as I say, temporal staff that is dedicated to projects or to initiatives, while, as you know, in the public system, it's very difficult to have this type of profiles in the staff. No?
You are also very strong in the industrial partners. What is your value proposition to the industrial partners?
So we have two types of links to industrial partners in Spain. So one is direct partners at the CLC, and we have mainly is IT providers. So we have Telefónica, we have Atos, and so on. So they're specialists in providing digital services to healthcare providers. There's also Abbott, and there's another industrial partner that is very interesting in Spain that works very well as facilitator, that is Genesis Biomed, which is a small company, but really supports in everything that is related to market access. So it's a very good link to the clinical world and the industrial part. But the other branch that we are very active in Spain is the national branches of the big corporates. They appreciate very much the short contact to the local ecosystem, and especially what we see of the interest of the industry providers in Spain are two things. Is to say the short contact with healthcare providers, so that this works really well and we can facilitate that through the network. And second is the internationalization. And what you see in the innovation projects in Spain is normally they are a bit larger than in other CLCs, so we have more partners per project, because we always push for this cross-border collaboration and at least to have a validation in another country and an international component, because this EU dimension is what makes unique for the EIT Health part in Spain, and is really the value that is looked at for the industrial partners.
Cristina, what you mentioned, that the industrial partners prefer shorter access to the healthcare providers. What does it mean in practical terms?
I think it's this reaction time what is key, because we have this very close contact with the healthcare providers. We can provide very rapid responses to any request. So if an industry wants to check something from the healthcare providers, they get a response very quick, and then if they can collaborate together or not very fast. So I think it's part of this process is really to filter fast. And I think that's essential in order to prepare successful proposals.
Very interesting. My next question is about the academic partners. What are they doing differently than other universities to be so successful?
Last year, we did a public partners workshop, and what we see is the central role of universities, not only because of their capacities as technology or as economics, scientific background, but as really as coordinators of the ecosystem. And what we see, for example, in complex projects is that hospitals or healthcare providers, they cannot have a dedicated person to manage all the complexities and the administrative work and the stakeholders together. And this role is really very good for the universities. So they have an added value in coordinating in a neutral manner the whole public ecosystem.
Very good. Do you have to train them, or there is already an existing knowledge within the universities to manage this complexity?
I think it's both. I mean, you always learn by doing, and the universities that we have, so both the University of Barcelona and the Technical University of Madrid, and also we have the Technical University of Valencia as linked third party. They all have learned through the years, but mainly what has been extremely useful is they have understood our model of organization, and they have a dedicated office to work with us, and they coordinate their faculties and their members and their projects together. So they do a lot of internal training, internal dissemination, internal filtering in order to select first at their side their best proposals.
It's very important, a very important message, because I also think that it is a bottleneck in many of the cases. Let me go to the next topic, which is about the local startup, deal sourcing and management. My question is here, how do you find the Amplifier startups and why do they participate?
We had two channels. First was the business creation managers, and I think the key to successful is just the business creation managers in our CLC, they know the ecosystem very well. So they had a list of potential startups that were interested from these projects, and we proactively engage them and send them to the innovation team. And secondly, we have also in the partnership some clusters like BioCat and other partners like partners engaging their own spin-offs and their own partner startups that have really contributed. So there was both lines. One was directly targeted from us. The other was directly targeted with a partner, always.
Please describe your approach about the Amplifier value chain analysis, because it's a very important and interesting topic for our partners.
So what we've seen is the startup, they come from a mentality that they work on their own, and they just have links to other parts of the ecosystems because they need to validate or because they need something else. The change to innovation projects is that suddenly they are part of a consortium and they have to think on a more project level and solution level, and there you have to put all the elements of the chain together at the same time, and that is a different mindset. So the startup, they were not expecting that. They were always just looking for one type of partner, and we say, no, for this project you need to have all the elements of the value chain incorporated, and we have put resources in order to complete this value chain.
Can you tell us an example how you did it?
For example, just to say, you have normally a startup that is looking for one hospital, sometimes here or sometimes in a concrete country. Okay, that is the start of the project, but that is not a successful project. You have to complement with definitely the expertise in the distribution channel, in the service provision of the market that you want to bring. In the regulatory steps, especially if we are talking now about, for example, digital health, that if you really want to accelerate that process in 3 years, we need to get all these resources as soon as possible in the project and not wait until they do the validation. That would be the old type, and then start the next step. No? So we have accelerated that process inside the same project.
How do you do this? Do you sit down with the startup, or do you immediately set up a working team? I'm curious about these actual steps.
I mean, in general, what we did with all the innovation projects is to look for the ones we had prioritized, is to see, okay, what are the strengths, what are the missing points, and especially in terms of teams, what were the capacities that were missing, and from which country should they come from according to their business or market plan, no? because you see sometimes these contradictions that they say, well, our ambition is to go to UK, and then they are doing the validation in Germany, and say, well, you have to have a bit of a coherent approach to these things, and also so make sure that you don't have gaps in the story of the commercialization plan.
Do you see any dominant countries or regions your startups projects would like to go in Europe?
Clearly, I mean, you go to the strong markets, and there's a clear focus on Germany and UK for the commercialization part, yes.
Do you see any opportunities for InnoStars and RIS regions to be involved into Spanish projects?
Yes, definitely, because that is also one of the things that we are bringing them is this mentality of Europe. Even if you just started one market, you will not succeed to scale appropriately. And the opportunity that we have with InnoStars and Spain, especially as we have probably more similar entry points and more similar cultures in certain areas, and there is an easier first step in the commercialization, and we are also promoting that.
But once you have the Amplifier applicants, how do you select the best ones? Is there any tips?
So we have always a methodology to rank startups according to, I mean, their product, their maturity, their investors, their team, which is also essential, and their impact in general. So that is part of the normal daily life of our business creation model. And what we are doing specifically since last year is adequating what is the best support for the different startups. So, and that includes this amplifier, but it may include also other accelerator programs.
Let me go to the next block of questions, which is the whole business plan cycle management, the matching, the grant writing, the application process. What did you do this year differently than last year? Because you are clearly very successful.
Thank you. So I think, I mean, it's all merit to the team. I just have to be very clear. It's a team,
yes,
and the close relationship to the partners. So first, what happened is we had a lot of proposals, as you may know, as EOIs to manage, and that was very clear that it was unmanageable. So we had a prioritization from the beginning. So, and that was done in collaboration with the partners. So we sit down with each one of the partners, select their EOIs, and look through them with them, saying, okay, this is the ones that we think have potential, these don't, and we have a list that was agreed with them. And with that, we have concentrated the resources on the prioritized ones to support them.
But you still had a lot of prioritized one because you had so many hearing invitations. What is more important? I'm just curious that the large number of inputs, EOIs, or the improvement of these EOIs into an application later on. Where did you have more? What is the key success factor in the final result?
I think the key success factor is the fit into the strategy of the partner and EIT Health. So it's not about the numbers. It's you have to have a good proposal that is essential for the partner, that is important for them, and that with the support of the CLC, we can optimize to fit into what we want also for EIT Health.
So what are the key success factors that contributed to the successful hearing admissions?
It's to have a clear, committed team on the side of the partners, and that the proposal fits really to their strategy. That is not something that comes across accidentally, but it really, because they have prioritized that themselves also, and that we have enough resources at our side to provide the support to optimize that concrete proposal. And that's why we, as I say, one of the success factors for us is that we have not dedicated a lot of resources to the other proposals. So we have said, okay, for the non-prioritized proposals, you have half an hour every week that you can make questions and answers, and that is the support we give. And we have all the information that we provide in webinars and in documentation videos in a repository so that people can access, but we haven't dedicated resources in solving a lot of doubts of people who were not prepared or in proposals that were not ready. Or this, I think this is essential if you want to make successful proposal, is that you don't lose time in actions that don't deliver any result.
What are the services you provide to the selected ones, to the short ones? How do you define that?
So there was a very close support of the pillar managers. Then we had 2 dedicated sessions to review and improve the proposals from a person with experience in evaluation, so whether from the team or external consultants. And third, we provided specialized training in the key things that we consider were essential for proposal. One was the cross-pillar part, in order to understand the knowledge triangle of EIT Health that was most of the time missing. Second is the part of impact, presentation, public speaking, and so on that you are going to see at the hearings. And third is the part of the market access, describing the business model and all this part. This is especially essential for those proposals not coming, mainly originated with the healthcare providers, for example. Yeah.
Once you have your selected shortlist, you provide these services. These partners, they need access to other CRCs to form an applying consortia. How do you network among the CRCs for matchmaking?
Part of them is they have done their partners themselves, so we have also to give credit to their also very proactive and agile spirit. But there's also what we did were 2 things. One, we have created a brochure of the capabilities and priorities of our partners that we have provided to the other CLCs in case they were looking for partners. So that was more on the other side. And in the part of partners that our community needed, we have helped them very individually. So for example, for a concrete project, we check, okay, we need a payer from this specific region, and we have contacted the CLC specifically to give that support. So it's not that we make broad requests, but we really target already the request from the CLC. If you take the summary, is you have to know very well your partners and understand their capabilities and their weaknesses, and be able to react very rapidly to complement these capabilities.
What do you usually need from the other CRCs? What kind of access or partners? Is it more industry or university or clinics or?
Definitely industry, and normally they look for, as I say, another site for validation. So that will be another ecosystem for clinic plus support for validation.
How do you see the openness from other regions to accept a Spanish ID to be validated in that region?
I think the problem is not openness. I think in the community there is interest for a collaboration. The problem is agility in EIT Health. We have so short timelines that if we don't have a good contact, it's very difficult to have a really good collaboration. And we've seen that, for example, in the rapid response, there was this project that needed 2 other hospitals in less than 1 week. And that was impressive, the work also from the other CDCs, that we got the collaboration from Erasmus Hospital and Louvain, thanks to the really short lines that we have in EIT Health, and the network.
During the COVID, it is very hard to establish new links. A cold call doesn't work. So you have to rely on your existing relationships, and here EIT has excels. If I come to the last block, which is about your local CRC organization structure, how you organize your people, your processes, my first question is, how do you train your colleagues because they excel in their work? And how does your team learn from past successes and mistakes? Because it's very important to be an agile and learning organization.
We have an excellent team at EIT Health Spain, and I can only say that from the beginning to the end. And when you manage very talented people with high performance, it's very important to keep them motivated. And part of this is this development career path. And we have a program for engagement of professionals, and especially a dedicated development program that is based on the 70-20-10 rule, which is 70% you learn by doing, 20% you learn by conversations or shadowing other people, and 10% you learn in formal training. And we have a process to reassess that every 6 months on our yearly plan also.
The 20% shadowing, how do you organize it? Because we don't have it yet, but it seems to be promising.
It's all in process, but what we do is, for example, learning from the other pillars. This is one of the things that is extremely successful in our team, that we have a very good collaboration between, for example, as you were saying, between business creation and innovation, or between campus that is transferring also initiatives to business creation and so on, so that we learn how is a project or how is a process in one of the pillars to the others, and they understand that part. And we also have done some shadowing in following, for example, interviews, or in following these rehearsal sessions that we always do a cross-pillar support.
How do you forge team spirit and culture among your partners in your CLC, especially during these COVID times?
I mean, with partners, it was easy because we were used to teleconferences and virtual meetings anyway. What we have changed this year is the annual meeting was also virtual, but we have kept it. And we keep very good openness and very close contact with them. And that is really on a day-to-day business. So I would say even everybody in the team, and I'm just thinking myself, I talk to probably 10 partners per week on a normal basis, just for any question that I have. So it's very important to keep these very short links anyway, and maintain that in this COVID. And for the team, we used to have, in any case, 2 days per week of telework before, and now it's kept on complete remote working on a voluntary basis. People can go to the office. What is essential now is we have a daily stand-up meeting, so we see each other at least 10 minutes, 15 minutes every day, and we get a quick informal update what's going on for each one of us in the team.
We heard a lot of very nice, very, very important insights. The know your partner, be very close to your partner, the agile way of working, and all the services you provide to the partners, and focus. So what is in the EIT Health strategy? What is in the partner strategy? What is important? Have an impact, and then provide services to those projects and handle in a very cost and time efficient way the other projects. Thank you very much. It is very insightful, and I'm sure that our partners will learn a lot. This was InnoStars Talks. In the next episode, we will speak with another inspiring innovator. Stay tuned, subscribe to the podcast, and leave a review. This will help me invite guests that you would like to hear from. Also visit our website, which is eithealth.eu/inyourregion/InnoStars. Thank you and goodbye.